And Dan Sisto, thanks very much for your time.
Well, thank you for allowing me to be here.
Well, it's a really important issue, and you are tasked with something actually fairly serious. And it's also kind of interesting to me that you're going to be sitting around the table with some principals here that don't always agree. We had Andrew Cuomo yesterday creating a Medicaid redesign team. He actually issued an executive order to create this thing. And it's going to be yourself, and then 1199 had George Gresham, and that's the healthcare union, and then his predecessor, Dennis Rivera, who is working at the federal level on healthcare reform. So, and then a number of other people. But it just seems like, do you really think that you guys are going to be able to come to some sort of agreement on this?
Well, we'll find out. You know, I think for the last several years in New York, well, we used to, let me put it like this, we used to have annual budgets in New York. Then we went to seasonal budget fights for the last several years. We did like 7 or 8 budgets in 2 years because we could never get it right.
DRPs too, right? You had to go back and there was a hole and you had to fill it, sure.
So what's happened is it's like become an armed camp, right? Every stakeholder group is so used to fighting every 3 months that we've all become skeptical, if not cynical, about the whole process, the politics, the dynamics. So at least this is a fresh start. It's something new for Albany. Bring the stakeholders in. I guess there will be 25 people or so on this task.
Yep, that's correct. Yep, 25 voting members.
Right. I don't know if we'll ever agree on a vote, but if they can surface enough ideas, you know, to point us in a new direction, and that's my hope, to come in and take the governor at his word. He said, I don't want to go through the same repetitive across-the-board cuts and slashes. I want to reform the system. And we have dozens of ideas, frankly, about how to reform the Medicaid program and do that in a way that improves the health system for everybody, not just Medicaid, saves the state money. Now, some of this is going to take more than 51 days, right, to, I guess, is what we have to
Your
March
deadline,
1st.
right. Your deadline is March 1st for consideration in the budget process. And then after that, actually, he wants you to keep meeting and submitting quarterly reports thereafter until the end of the fiscal year, which in New York it runs, ends in 12. It's 11 to 12.
Yes.
Yep.
Yes. So, you know, it's extremely complicated, but Medicaid itself is complicated. We have probably, we're getting close to 1/4 of the people in the state on Medicaid.
You know, what's interesting is I actually had Assemblyman Gary Pretlow in the other day, and he said, first of all, he said he didn't think that the governor could actually really cut his way out of a $9 to $10 billion budget deficit without raising taxes, without borrowing, without doing something, because this so significant, the amount of spending, and some of it's mandated. Medicaid, for example, with the health care reform bill, and this is what he was talking about, law, at the federal level, assuming, of course, that the Republicans don't manage to repeal it or repeal certain parts of it in Washington, actually enables more people to get on Medicaid, and that actually makes the program more expensive, does it not?
Yeah, well, the recession has added about 700,000 people to the rolls over 2 years, and as you point out, the new reform law is going to channel more patients, more people onto Medicaid, and we hope that they keep their private insurance as well if they have it. But the idea behind the federal law was to take the 50 or so million people in the country and provide insurance to about 32 million of them. So we'll still have 23 million without insurance. Many of those will be still on Medicaid or undocumented, get no help at all, except they end up being an expense for hospitals.
Right.
And then we have, as I said, the effect of the recession. So if you look at Medicaid today, it's talked about like a 4-letter word, you know, like something evil or wrong.
Sure.
But the reality is the vast majority of the people on it are children. Most of the money is spent on our parents and our grandparents, right? So it's going to be very hard to shrink eligibility when the federal law says you can't diminish the number of people that you're providing care for.
One of the things that we've been actually talking about for years is this issue of looking back, right? For people who are elderly, who then get onto Medicaid, they divest of their assets and they get onto Medicaid, and they have, in their old age, they have the state taking care of them, taxpayers, even though they might at some point have had a considerable amount of assets that they then transfer to other family members so they can qualify. Do you believe that that is a place that we should target and will be targeted by this task force?
I hope that each of us comes to the task force table with a willingness to improve on our own performance as well as think about how others should perform better. So as providers, I think we could do a better job at coordinating the care and managing the care we give patients so they're not coming back repetitively for the same test or the same exams. I think that government itself, right, could discipline itself better so we don't make promises that we have no ability to pay for. But certainly the public could do two things. They could try to keep themselves a little healthier, and a lot of that comes with prevention and primary care. But a lot also comes with how we eat and exercise and the diabetic explosion that's going on. How do we deal with that?
But isn't that what Governor Patterson was trying to do with the soda tax?
He was, but we never felt the gun to our head quite like this. So the other thing that we could do is the point you were on, I think, is let's say that there has to be a certain amount of responsibility by spouses not to just deny that they're going to contribute to the care of their loved one who goes into a nursing home, or pay the most sophisticated lawyers to find ways, irrespective of how many assets they have, to shield and protect them, right? So we can't have everything. All of us can't have everything. Politicians can't make promises they can't pay for. We as providers can't run a system that isn't better disciplined and controlled. And patients and the public in general, have to begin to modify behavior or be held more accountable.
But there's little that you can do as a Medicaid redesign team to get people to exercise more. I mean, the incentive for the people to exercise more or to eat better or to, I mean, where's the stick for that?
There's not today an obvious stick for that. That's true.
Right.
But a lot of that has to do with putting the right kind of effort into education of the public, but it also becomes the responsibility of insurers and providers who, in a future redesigned health system, would have responsibility for a patient before they become ill. Would take care of them when they visit the doctor, when they're in the hospital, but also responsible for them when they leave. And if we were to pay physicians, hospitals, nursing homes, home care in a bundled way, one payment to take care of the patient over time, we would have the responsibility, like one would hope managed care plans would.
Well, I was just going to get into that. Is it managed care that's going to take the biggest haircut here in terms of trying to get Medicaid costs down? Because it seems reports.
I think not.
You think not?
No, I think it's almost the opposite.
Or long-term care? I mean, is that where it's going to go?
Well, nursing homes, home care certainly have been growing rapidly, the costs. So I don't think we should go in with the idea we're going to knock out all the benefits from people or curtail it that way. But we could, for example, say we're going to coordinate the care, manage the care. It doesn't have to be insurance company managed, although it might be. It could be, as I said earlier, networks of hospitals, physicians, nurses, nursing homes, home care, coming together and organizing themselves to be responsible. It's easier maybe even to aggregate them than it is to disaggregate the way they're paid.
Right.
But that's why it's going to take a couple of years to make this kind of a change. What scares me is that we think we as a collective probably will be able to redesign the system. But whether we can do it in time for a state budget,
well, that's what I was just going to ask you. Is this possible? I mean, it seems that Andrew Cuomo has given you not a lot of time, and really, I mean, at this point, we have a $9 to $10 billion budget deficit, but that balloons in the out years. I mean, that just keeps growing and growing.
Right.
And there was at one point a report that it would be a $2.1 billion Medicaid cut. Now, that's not been confirmed. Of course, the budget doesn't come out until the February 1st date, and so we don't know what's going to be in there yet. However, we don't know what you guys are going to recommend. However, that's actually not a cut per se. That's more or less flat, is it not? It's keeping the costs from rising at the level that they have been in the past.
Right. Well, it's important you're absolutely right. I just take a little exception to cost. It's expenditures. So the difference is if I have a child in college, I pay $30,000 a year. The next year I have two children in college, I pay $60,000.
Got it.
My cost didn't go up. My expenditures went up.
I see.
Right?
I see. Right.
So
because the college cost is flat.
Right.
Right.
Now, what's happened, for example, with hospitals is if you look from 04 to 09, our costs have actually gone down 2% in Medicaid. But the amount they spend on hospitals has exploded because we have so many more people in the program. Right? So we have to figure out what is our appetite for the promise we want to make about how many benefits, how open-ended those benefits are going to be, whether people can choose to come and go wherever they please, whenever they please, or are we really going to not have any additional revenue or let revenue go by the boards that currently are revenue streams, like the tax on millionaires? Is that really going to go by the boards?
Do you think it should?
Personally, I think it should be phased upward, so that today we tax people at $250,000 with this surcharge. I think it's going to take 3 or 4 years to reshape the system, the health system. I think over 3 or 4 years we should keep raising the amount of people who no longer take the surcharge. But let's not just walk away from $10 billion of the $40 billion that is on the table. Now, that's probably not going to be real popular.
Probably not.
Right. But
probably not.
But let's do things in a reasonable, phased way, is my view. And providers and insurers and government, we all have to think a little bit, I think a little bit more openly and not go in with closed mindsets about what we're capable of doing. The idea of bringing in, for example, the Medicaid director from Wisconsin.
Yeah, John Helgerson.
Helgerson, yes,
Pardon me, Jason Helgerson.
Jason Helgerson. Now, I think his value isn't so much the specifics of what he accomplished, but the fact that he got all the stakeholders around the table and facilitated this discussion.
Right.
If you marry that with a brand new commissioner of health who comes with experience in rural Pennsylvania with the Geisinger system, this is a system that the Obama administration holds up as an example of what future health care should be.
Right.
And also works at Bellevue in New York City, taking care of uninsured. This is a high safety net hospital for uninsured and Medicaid patients.
Yeah, that's a lot of smart people.
Right now, and so 2 new objective faces who can take a fresh look at New York. I have no choice but to say, look, nobody could be more skeptical or cynical about government after 25 years than I, right? But let's try it. Let's give our best shot at working together to redesign the system under this new framework.
Do you know when you're going to have your first meeting yet?
I think they're going to give us an overview just tomorrow by conference calls or whatever, just to let us know who else is on the task force and lay out a program. But I'm not sure after that. You may know more than I do.
Not yet, but when you guys get into your work, we will have you back. I want to thank you very much for joining us, Dan Sisto.
Yep.
It's good to see you.
Thank you.
Nice to see you.
Great. Thank you.